Hi, and welcome to this rest station. The next 3 sessions are GP skills session, and in those sessions we're aiming to do a number of things. One is introduce you to some new consulting concepts, reinforce the Year 3 clinical skills of history taking and examination, identify the differences between a full history and examination that you might have taken in a long case presentation or preparation in Year 3, to the more focused time-based clinical approach that you'll see happening in your general practice setting. Give you some ideas about how to prioritise and organise management options given the time constraints, particularly using the concept of continuity of care over time, and seeing how you make the most out of every patient encounter. So the new consulting concepts in these 3 clinical skills sessions, the first is the concept of telehealth in general practice. This has come to the fore in 2020 during the COVID lockdown, and it will continue in general practice indefinitely. There are some specific requirements for telehealth in general practice, which I'll talk about in a short time. The general practices are encouraged to load patient records and details, management plans, etc., onto the electronic MyHealth record. And this is a repository for clinical information that can be accessed from different areas, either interstate, in a hospital setting, or within different general practices. Another concept is using a cardiovascular disease risk calculator when assessing patients' requirements for medication. And then in general practice, you'll see the use of online resources or paper-based resources to reinforce information that patients are needing. And the concept of motivational interviewing is introduced to try and attempt to change behaviours of patients for a more healthy lifestyle. So telehealth in general practice is the thing that I want to speak about now. Let's just look at the video made by the General Practice Supervisors Australia. So in summary, the telehealth in general practice, initiating the consultation is important to identify the person by name and date of birth, making sure that they're in a situation where they're safe and secure and confidential to talk. If there's anyone else with them, that be aware of that, and get consent about taking a history, etc. by telehealth. This is important in particular in context of consenting for billing for Medicare. The next consultation skills and information relates to My Health Record, and we'll open this up.
I was 17 years old and I met my husband Damien. We were happily married by 24, and then at 26 Damien had an accident and lost his sight completely. They couldn't start the operation until I'd signed all the papers and released all the information for him. So with a My Health Record, that process could have started before I actually got there. Our world sort of turned upside down and it changed completely. Especially being young people which were healthy, going into a world of hospitals and doctor's appointments and testing and all that sort of stuff. It wasn't too foreign because I'd done it with my mum. Mum had mental health issues, so a completely different way of actually balancing the health. My Health Record would have been amazing back then. Over 20 years, you can imagine how many health professionals you would see with a severe disability. The amount of people we see is just phenomenal, absolutely phenomenal. Hundreds and hundreds and hundreds of providers over those years, and could not tell you anything else. When I look at My Health Record now, mine and my husband's My Health Record, I can see that we have our advanced care plans in there. We have our doctors, some of our doctors' stuff's in there. We're still waiting for the rest to be uploaded, but our doctor's actually about to come on board, which is great. We'll have all of that. Where is My Health before My Health Record? Specialist has got some piece of it, the hospital's got another piece of it, my GP's got some of it. If I see another GP, they've got another piece. It needs to be all put into one place, and it is. 20 years Dame's been blind. I've never heard him complain about being blind, which makes my job so much easier. He tries to make it as easy for me to be his carer as he possibly can. And we're husband and wife. Dame's disability doesn't own us. I look into the future and go, you know what? If I lose capacity, or if my husband loses capacity, we're going to have all of our medications in one place. We're going to have all our testing in one place. And when we go somewhere, I can just open my phone and go, this is the information you need to know. Open your computer. I've got a My Health Record. Check that. It's there.
So that's the information about My Health Record. It's a slow uptake in general practice, but there are potential for things like investigations, radiology, discharge summaries, mental health plans, management plans, etc. to be on, as well as a shared health summary. And we'll look at that in a small way in one of these clinical skills sessions. Another thing I want you to look at is this thing called the Cardiovascular Disease Risk Calculator. This is National Heart Foundation information about cardiovascular risk charts. And you'll see that there are risks for Indigenous and First Nations people starting at a younger age. There are men, there are women, people with diabetes, people without diabetes, systolic blood pressure, smoking, non-smoking, and then cholesterol, total cholesterol to HDL ratio. And a combination of all these will give a setting of risk, cardiovascular risk over 5 years for that particular patient. And using the risk charts, we'll identify those at moderate to high risk who require intervention, usually with non-pharmacological as well as pharmacological means, and those with low risk, which can be safely managed with motivational interviewing to try and change the lifestyle, and as time goes by may need other active intervention. So we're aiming to also reinforce your Year 3 skills of history taking, some examination, making sure that if you're going to investigate, the investigations are appropriate and focused, and then management in primary care or whether you need to refer to secondary care or other. So we'll ask you in the clinical skills what your management strategies are. So it's focused time-based clinical assessment. So in GP, consultations are booked by time. That's similar to what your clinical sessions will be, usually 10 or 15 minutes. Often what seems to be an enormous task can be broken down without neglect of the important issues. So this capacity to prioritise and organise are important skills to be gained. And using the concept of continuity of care will aid this task. So if you can't get everything done today, you can get the patient back. If you need a preventative health check, you can target that or highlight that in your initial consultation, say we need to spend some time to get you back to follow up on these important issues. Or if you have a number of, patient has a number of things on their agenda, you may not have time to address everything, so you get the most important one or two and then schedule the time to finalise the others. So make the most of patient encounter. So this is a patient-centred approach which is paramount in general practice. This is different to the disease-centred approach that is often required in a hospital setting. Identifying the patient's agenda and adding preventative activities can be achieved during a consultation. Additional consulting skills such as motivational interviewing may be needed to encourage behavioural change. Above all, getting to know your patient is the key, and you'll have perhaps more than 15 minutes in your everyday GP consulting to actually have a chance to chat with the patient, have an idea of what their community situations are like, what their family and social situations are like, what their lifestyles are like, what their previous medical history is, what their medication is, etc. The interesting thing in context of general practice is your GP usually knows that before the patient comes through the door. And they're at an advantage in context of management. So what you see is taking shortcuts in general practice isn't so much a shortcut, it's just the fact that the patients are known to their GP. Okay, so enjoy your skills. Thank you.